Could a mask mandate make a return in Chicago and across the state? We go to Paris for more. Paris.
Brandon, the Illinois Department of Public Health is warning about a slow rise in COVID cases throughout the state. It comes amid rising cases nationwide and after the city of Philadelphia announces it will reinstate its own indoor mask mandate. Chicago public health data shows a steady rise in cases here as well. So will an indoor mask mandate return, and if so, when? Here to talk to us about all of that is Dr. Rachel Rubin, Senior Medical Officer and co-lead at the Cook County Department of Public Health. Dr. Rubin, thank you as always for joining us. And I want to tick off some of the latest Chicago stats. So the current daily COVID caseload averages 440 new cases per day. That's up over 305 cases per day last week. That's a 44% increase. What do you make of these numbers?
Well, first of all, my jurisdiction is suburban Cook County and not the city, but our numbers parallel the city quite closely. So to make, sort of general statements about the Chicagoland area, we are seeing a rise in cases, and they are predominantly this BA2 subvariant of Omicron. And so it's not to be expected that we are, not to be unexpected that we are seeing this rise in cases right now.
And in fact, Governor Pritzker today was asked about the possibility of reinstituting the indoor mask mandate. Let's take a look at what he had to say.
Look, I think that towns, cities across Illinois, not to mention across the country, should do what they feel is necessary in their communities to keep people safe. But I feel like right now, and listening to the IDPH and our experts on the outside of IDPH, that we're in a pretty good place.
Dr. Rubin, given the numbers in Chicago and suburban Cook County, as you said, at what point do you think a mask mandate might be useful here?
Well, in alignment with the newer CDC rubric to determine community transmission and community risk, looking at total numbers of cases increasing in and of itself doesn't give us enough information to make decisions about whether we would want to put in place stricter mitigation again. We need to be looking at hospitalization rates and emergency room utilization and putting all of that information together to see whether there is an increase in seeing severely ill, people getting severely ill cases of COVID, and if there is an impending strain on our healthcare facilities. And at this point, we do not see that. So we are still in this watchful waiting period and hoping that we wouldn't have to mandate indoor masking, for example, at least not at this point.
And at some point, would you expect to see a corresponding rise in those hospitalization rates? Or is the situation different now with vaccination and with this BA2 variant?
I think that our vaccination rates, especially in Northern Illinois, are quite good in terms of first doses and complete series. We need to be catching up on those boosters. We need people to really be getting out and getting their boosters if they qualify for them. Please, please, please. I think that that's very important. But even with that, many people got the original Omicron variant and likely may still have some level of immunity. It's not yet waned for this subvariant of Omicron, this BA2. So I think that that's potentially protective. Also, indeed, because of the vaccinations that we've had, that would be protective. So I anticipate we will begin to see in a week or two a rise in hospitalizations. But the hope is that that rise won't be certainly, significant, certainly not close to the levels that we had in January, because we won't be seeing as many people with severe disease requiring hospitalization or potentially causing deaths.
So perhaps a high level of immunity right now, if you take into account natural immunity and vaccination. The governor said he wants to leave it up to local health officials like yourself to make these decisions. Is that the right approach, a patchwork system as opposed to one size fits all for the state?
Well, as we can see right now in the southern tip of the state, they already are in higher transmission levels, either the moderate or high transmission level, according to the CDC guidance, while we're not that way at all in Northern Illinois. So I think to have a somewhat localized approach is not necessarily a bad thing. I think that it's okay for the local health departments to be able to make those decisions. I would hope that the state would give us appropriate guidance and leadership on how they would like to see us do this. In terms of our department in suburban Cook County, we try to be in alignment with the city because we're really all one big community. People who live in the suburbs work and shop in the city and vice versa. And so we are really one sort of big, large community, even though there might be pockets of higher or lower transmission even within the Chicagoland area. So to be able to make these local decisions and that being supported by the governor is a welcome discussion on his part.
In terms of masks, a lot of people have their own opinions on the efficacy of masks. The data seems to show that cloth masks don't protect one from the virus as well as perhaps an N95 or N94. So would a mask mandate be protective against BA2?
Well, as part of a mask mandate, it doesn't just mean put on any old mask. It would go with it very appropriate guidance on what kind of masks. And in fact, these N95s, N94s, KM95s are really respirators. They look like masks as you put them on a mask on your face with elastic, but they actually have a filter. The mask is actually a filter, and that's why it's called a respirator, that filters out these very small particle sizes of the virus. So, and also the things about these respirator masks is that they fit very securely and tightly around the face if they are fitted appropriately. While cloth masks are leaky, right? They might provide a little bit of protection. They might protect other people, frankly, more than you, because they might protect your breath that might be infected with COVID from getting out into the air. But the particles that other people and aerosolized particles that are coming from other individuals that might be infected are going to go around the edges of that cloth mask or potentially through the cloth mask. So we need to be giving the appropriate guidance about masking and also the appropriate guidance of where to use them and when. I mean, predominantly being outdoors is much safer than being indoors. The weather is getting warmer, keeping our fingers crossed. So people should be outside. Indoor spaces that are not well ventilated are a real problem.
Right. And we're keeping our fingers crossed that weather warms up sooner rather than later. And our thanks, as always, to Dr. Rachel Rubin. Thanks for joining us.
You're welcome.